Hi there and welcome to the first Team Brief podcast of 2016. Today I'm in the new Major Trauma Ward at Preston, which has recently been opened. The recently refurbished area at the end of Ward 14 contains 10 beds for major trauma patients, and they will receive newly admitted major trauma patients where they will be cared for by our specialist major trauma team. This new ward is part of our work to establish our major trauma centre after we were chosen to be one of 8 adult-only major trauma centres in the country in 2012. The ward looks great, and I've been speaking to some of the patients who say that they are really happy with their care, so huge well done and thanks to all of the team who work in this area. The Surgical Assessment Unit has also recently moved from Ward 12 to the Emergency Decision Unit just behind the Emergency Department at Preston. This means all our patients with unplanned medical or surgical needs are assessed at our front door. Organising care in this way will ensure that patients with similar needs are looked after together by appropriate teams, and specialist staff from services throughout the hospital can come to see the urgent patients in one place, making the whole pathway and process much smoother. There are already 40 to 50 admissions a day to the SAU, so we're very busy, but providing a much better experience for our patients who previously had to wait in an annex by Ward 12 to be seen. Now, most of you will know that Sue Reid, our nursing director, is retiring next month after 40 years working for the NHS. So a huge congratulations and thanks to Sue, and many of you will have an opportunity to say your own goodbyes to her. But after a rigorous recruitment exercise, I'm delighted to tell you that Gail Naylor has been appointed our new Nursing and Midwifery Director. Gail is currently the Director of Nursing and Midwifery at North Cumbria University Hospitals NHS Trust, and had the same role at Liverpool's Women Trust for 5 years before that. Gail has worked in a variety of clinical roles during her career, as well as leading and managing teams in a number of senior leadership positions in the NHS, so she will be a fantastic addition to our team when she joins us in March. Now, I just wanted to give you an update regarding our master plan. Over the past 18 months, we've been working together to review how we provide hospital services, to develop a plan so that we're sustainable for the future and we can continue to provide safe, effective and high quality care. This work has included producing a clinical services strategy, and we've started to develop a new model of care that separates elective services from acute care, and we're beginning to consider how our hospital buildings could be configured to deliver the care in this new way. We now need to work alongside our commissioners and other local partner organisations to build on the work we've already done, because this requires a much wider transformation of how health and social care works in central Lancashire than we can achieve by ourselves. All the valuable input provided so far by you during the master plan phase will now be taken forward. This wider transformation programme is called Your Hospitals, Your Health, and it brings together all the different services and organisations involved so that patients receive care that is properly joined up and looked after in the most appropriate way. The programme is overseen by a board that is chaired by NHS England and involves ourselves, the clinical commissioning groups, Lancashire Care, Monitor and Healthier Lancashire. NHS England and Monitor recognise that service transformation requires investment and will make money available to support providers and commissioners to implement major change programmes that ensure future sustainability and secure better clinical outcomes and patient experience. Working groups are currently being established that will look at clinical services, engagement and consultation, finance and sustainability, so a lot of things to be considered. A range of staff from our organisation, including myself, are already actively involved in this work, and will provide further information when we can about how you can get involved in the work. Overall, the Your Hospitals, Your Health programme is intending to develop some options for how health and social care will work better together in the future, and that will be produced later on this year. It may well be that this results in a wider conversation about services with our patients and lead to a consultation with the public. Whilst that's ongoing, we need to continue our work to implement our new models of care within the current estate and infrastructure to make sure that we provide care that is safe and effective in an efficient and financially viable way, and also improve working lives for our staff. Our big plan sets out our overall priorities for the year ahead, and now the new divisional restructure is nearly complete, work is underway to develop clinical and corporate business plans that set out the priorities for each area. These priorities will then translate into personal objectives for staff so everyone understands what they need to do and how they fit into our overall aims. You'll hear about the big plan in May, and you'll be involved in developing your clinical unit or corporate business plan in the coming weeks. Please ask your manager for some more details. So this is a really exciting period for us, and we have a golden opportunity to drive transformational change that will enable us to work more efficiently, secure our long-term viability, and provide better care for our patients. There will be lots and lots of opportunities for you all to be involved in all of this work, so please look out for further updates in Team Brief. In the meantime, we've introduced some big conversation events so that you can share your thoughts and ideas and discuss what can be done better. Everybody is invited to the trust-wide events, or there are some smaller events being held in different divisions. For more details, please have a look on the intranet and don't miss your chance to make a difference and have your say. Also, within the next month or so, we'll be opening our new Health and Wellbeing Centre for staff. Work has recently been completed and a range of support services will be available there, such as help to quit smoking, lose weight, manage your finances, or how to manage stress. We know how important it is to look after the health and wellbeing of our staff, and that's why we've created this new facility. Keep an eye out for the intranet for details of the official opening. The new centre is just one part of our health and wellbeing strategy, which is aimed at ensuring our staff feel able and supported to do their job. Part of the strategy is looking at sickness absence and why our staff may be off work due to illness. Sickness absence levels have been increasing month on month, and it's a real concern to us because absence makes it difficult for us to maintain our staffing levels, and it creates financial pressure because we need to cover gaps with bank or agency. We also know that our absence rates are higher than most other NHS trusts in the North West, and this is continuing to attract external scrutiny. As part of the sickness absence management strategy, the HR teams are working with the areas with high sickness rates to understand the reasons for absence and to see if there's anything that we can do to help and support the staff. And while we're talking about staff wellbeing, I know that many of you feel under extreme pressure because of our staffing problems. We've launched a new web-based recruitment system called Track, which is similar to NHS Jobs, but with greater functionality that will enhance and speed up the recruitment process. All requests to fill a vacancy are now being processed through Track, and training is available. Have a look on the Track intranet page for more information, and if you've got any questions, please contact the recruitment team below. And staying on the subject of staffing, some of you might be aware that in April last year, the government announced a national cap on the amount that NHS trusts can pay for agency staff. The cap had been reduced on a phased basis, and the final reduction will be implemented in April. All NHS trusts are expected to implement the cap in accordance with the guidance, and foundation trusts that are subject to regulatory action by Monitor, which we are, must comply fully. The government has set a clear expectation that the agency cap can only be breached in exceptional circumstances where there is an immediate and serious risk to patient safety, and all breaches must be reported to Monitor. Our board is committed to doing everything we possibly can to implement the agency cap whilst keeping patients safe, because our agency bill is significant and any reduction will help our financial position and means that we can better protect our frontline services. Since the cap was introduced, we have worked hard to make sure we have enough of the right staff working shifts to enable us to maintain the safety and quality of care. This work has included reviewing rotas, negotiating reduced fees with individual agency workers, and increasing recruitment to the staff bank. For the longer term, we'll be taking a number of actions to attract and retain enough staff so that we will need to rely less on agency workers. We have managed to successfully implement the cap, and we're confident that the robust processes put in place to manage staffing levels and implement the cap have been effective and patient safety has not been compromised. Any patient safety issues that could potentially arise from difficulties in staffing rotas are reviewed by the senior divisional teams and escalated to the executive team for advice and support where necessary at the time. So far, it's working well, and we're maintaining safe care for our patients. If you have any concerns about the effect of the implementation of the agency cap on our ability to provide safe care for our patients, please immediately escalate the issue through the usual management channels, after which, if you remain concerned, please contact the senior divisional team. Okay, now let's have a look at our performance figures. So far this year, we've seen 46 cases of C. diff, which were attributable to the hospitals, which is 4 below our year-to-date objective. Reviews have been completed for 35 of those cases, of which 11 were deemed avoidable due to lapses in care. 2 cases remain under review. We've had 1 case of MRSA in January, bringing the total to 3 this year, but all 3 relate to the same patient. We achieved our harm-free care target for January. It's great. However, early indications show that we missed our emergency department and 18-week incomplete pathway targets, and we only achieved 6 of the 9 cancer standards, which is hugely disappointing. Unfortunately, we've also missed our targets in terms of patient experience, which again is extremely disappointing and worrying, and something that we really need to turn around. While we're talking about patient experience, we've been working with patients and staff to translate our values into some simple, practical actions that will make a real difference to everyone's experience of care, our always events. So we pledge to always do these things to improve things for our patients. Simple things like always treat patients how you would like to be treated, or always involve patients in decisions about their care. We've produced a set of short animations to highlight what the always events are and why they make such a difference. Please just take 5 minutes to watch them. Now, just a few other messages before I round up. Firstly, all nurses and midwives need to undergo a new revalidation process set out by the Nursing and Midwifery Council to demonstrate that you practice safely and effectively. To find out exactly what you need to do, look on the intranet, and if you have any questions, call Mandy Barker, Head of Nurse Staffing. The government is introducing a new single-tier, flat-rate state pension for people who reach state pension age on or after April this year, which will replace the basic state pension and additional state pension schemes. Members of the NHS pension scheme are currently automatically contracted out of the additional state pension and pay reduced national insurance contributions. But from April, contracted out schemes will cease, and therefore you will start to pay a higher amount of national insurance contributions. A document has been produced by NHS employers to help you understand what the changes mean for you, and if you have any questions, please contact payroll. Now, a quick reminder that fax machines should no longer be used anywhere in our organisation. The use of fax machines is no longer authorised and hasn't been for more than 2 years. Instead, faxes should be replaced with scanned documents sent by secure email. This new method means the information is more secure, and it also helps us to save money. It is expected that all existing fax machines will be removed by the beginning of April, no exceptions. Please explore the alternatives, work out the process among your colleagues, and stop using your fax machines. If you need any help or have a fax machine that needs removing, please contact the Facilities and Estates Help Desk. The ClickView Clinician Dashboard application is now live and accessible to all surgical consultants via the Quadramed Consultant Desktop. The application provides a one-stop shop for personalised and tailored information about things like waiting lists, theatre and outpatient metrics, and training and appraisal status. For now, it's just available for surgical consultants. The next phase will be to introduce it to other areas. For more information about the app and how to access it, please have a look on the intranet. The Business Intelligence team want and need your feedback on its relevance, accuracy and ease of use. So please use the email address below to ask any questions or share suggestions. And finally, a big congratulations to our Hotel Services Department, which has been awarded a Customer Service Excellence Award for the 3rd year running. We were originally given the award in 2012, and on-site reviews take place every year, where assessors talk to patients, look at the quality of our services and our outcomes. Big well done to the team for their great achievement. And that's it for this month. Thank you to the team here at the Major Trauma Ward for letting us come in to have a look today. If you have a new development or you'd like us to come and film the podcast from your area, please contact our communications team. And do join me again next month for another update.